No, not.
Amen.
Hey, how are you? My name is Amy. I'm going to be your student nurse for today. Could you verify your name and date of birth for me, please?
My name is Garcia-Autry. I was born June 26, 2000.
Okay. I'm just going to go ahead and begin by washing my hands. I see that your doctor has ordered that we do some vital signs, a cardiac assessment, and then a respiratory assessment. Are you in any pain today, sir?
Yes, ma'am.
Okay. Where does it hurt at?
In my left shoulder.
Okay. And on a scale of 0 being no pain at all and 10 being the worst pain you've ever felt, could you rate that pain for me, please?
Probably 6.
Okay. And does it stay in that area or does it go down anywhere else?
It goes down my arm.
Okay. And when did this pain start?
When I was at the gym.
Okay, and could you describe your pain? Is it like a sharp pain, dull pain?
Probably sharp.
Sharp, okay. And is there anything that makes it any better?
Just stretching it out.
Okay, anything worse?
No, ma'am.
Okay, and I'm just going to begin by taking your radial pulse if that's okay with you.
Yes, ma'am.
Okay, so your pulse was 70, which is normal, and then your respiratory rate was 18, which is also normal. And I'm just going to go ahead and begin by doing your blood pressure, if that's okay with you. So I'm going to take it on this arm. Is there any reason why I can't use this arm today, sir?
No.
Alright. And what is your blood pressure normally?
120 over 70.
Okay. Are you on any blood pressure medication or anything?
No, ma'am.
Okay. I'm just going to place this around your arm. Go ahead and place this bell on your arm. It might feel just a little bit cold, okay?
Yes, ma'am.
Okay, so your blood pressure is pretty normal. It's 120 over 80. And it's going to move this over here. Slow this down. Alright. So next I'm just going to begin by going ahead and just doing your, clearing your lungs, alright?
Okay.
Okay, I'm going to get you to take a deep breath, okay? Okay, and right now I'm listening to your right upper lobe. Another deep breath for me. Okay, and we're listening to the left upper lobe. I'm going to go down just a little bit. Another deep breath for me. And we're still in the left upper lobe here. I'm going to go over this way a little bit. Another deep breath for me. Okay, and we're in the right lobe there. Another deep breath for me, please. Okay, and then we're listening to the right lower lobe there. And I'm going to get you to take another deep breath. Okay, we're listening to your left lower lobe. All right, one more deep breath. I'm listening to your left side laterally. Go ahead and take a deep breath. Okay, and I'm going to do the same thing for this right side. We're listening laterally here too. Go ahead and take a deep breath. Okay. Could I get you to turn around that way for me, please? Okay. Go ahead and take a deep breath for me, and I'm listening to your right upper lobe. Okay, another deep breath for me. Okay. One more deep breath for me. Okay, and another one. All right, great. You can go ahead and turn back around and face me again, please. Okay, and could I get you to cough for me? Okay, so the patient doesn't have any sputum at all, and their coughing is normal. And if you were to get any like lung infection or anything, we just want to make sure that you take a deep breath. And then you're going to cough after that deep breath. Okay, you want to do that about 10 times an hour, but no more than 10 times an hour. You don't want to do that consecutively. And then we're also going to try to use your spirometer. So we're going to use your spirometer. You're going to take a deep breath. Hold in for about 5 to 10 seconds. We're going to try to get the little ball that's up here to go all the way up to let's say about 4 for today. Okay, go ahead and you can breathe out. Okay, and you want to use your spirometer a couple of times an hour. Okay. Alright, so next we're just going to go ahead and I'm going to start with your cardiac assessment. Alright, if I could get you to turn to the right for me. Okay. And just turn your neck this way. Okay. Looks fine. And then I'm going to come on this side and go ahead and turn that way for me, please. Okay, everything looks there. Looks good. You can go ahead and turn back and face me if you don't mind. Okay. And next, I'm just going to go ahead and feel your pulses one more time, all right? And I'm doing the radial pulse right now. Okay. And then this right here would be your brachial. If I could get you to lift your arm for me, this would be the axillary under the axilla. You can put your arm back down. And I'm going to go just right here. This would be the femoral. And then behind the kneecap, so you just extend your leg. Behind this kneecap would be the popliteal. Same thing for this other one. Popliteal would be behind the kneecap. I'm going to go ahead and assess the radial pulse on this side. The brachial pulse over here would be in this area. So lift your arm for me, please. The axillary would be under the axilla. Put your arm back down. And then the femoral would be right there again. And I'm going to go ahead and assess our patient for capillary refill. Okay, and I'm going to go ahead and assess for edema. Let me know if you feel any pain. And have you had any swelling of this arm at all? All right. I'm going to do the same thing for your other arm. I'm going to go ahead and assess for capillary refill. Okay. I'm Do the same thing for this one. I'm gonna go ahead and check if he has any edema. Have you had any swelling in this arm?
No.
Any pain? Okay, and I'm just gonna go ahead and I'm gonna listen to your heart. Is that okay with you?
Yes, ma'am.
All right. Okay, and I'm listening to the aortic valve. Okay, and I'm going to move over this way and I'm going to listen to the pulmonary valve. Okay, and I'm going to go down just a little bit and we're listening to herbs. Okay, I'm going to go down a little bit further and listening to the tricuspid. Okay, I'm going to come right out. We're just going to be listening to the mitral valve. Alright, everything sounds good there. And also the carotid arteries can be found right here on this side. And then you can also find it on this side. And I'm going to go ahead and assess our patient for any edema in the lower extremities. Do you feel any pain at all?
No, ma'am.
Okay. I'll go ahead and do this leg. Any pain at all, let me know.
No, ma'am.
Alright. And I'm just going to go ahead and do the capillary refill. I'm going to do the same thing with this foot. I think I'm going to go ahead and feel for the dorsalis pedis. Do the same thing for this one, dorsalis pedis on this side. Okay, and this pulse is a 2+, which is expected. I'm going to go ahead and do the posterior tibial. Same thing for this side, posterior tibial. Okay, 2+ on both of those. And do you feel any chest tightness at all?
No, ma'am.
Okay, are you having any trouble breathing?
No, ma'am.
Okay. And also, I realized that I had forgot to do in the other part, I forgot to listen with the diaphragm, but we would also do that whenever we're assessing the cardiac assessment. And that's all we've got for today. And let us know if you need us or if you feel any more pain. All right.